Já jsem Ivona Remundová a ve 41 letech jsem zjistila, že mám ADHD. Neurodivergentní život, stovky nezvládnutých emocí, pozdní příchody, zapomenuté schůzky, nedokončené projekty, ale taky schopnost za jednu noc dohnat to, co by jiným trvalo týden. S manželem Filipem dokumentujeme moji cestu. Od diagnostiky přes terapii až po setkání s odborníky z celého světa. Tohle je Klid v hlavě, dokumentární podcast pro neurodivergentní lidi a ty, kdo je chtějí pochopit.
Dnes nejdu spát.
Dostaneš pokutu?
Já to nestihnu, já na to zapomněla.
Když se budeme učit plavat.
Zítra pošlu. Já ti nevnímala. Zastav. ADHD. So my first question would be taking you at the very beginning of your career, because you are one of the most experienced experts on the field of ADHD in psychiatry. Why and why? What was the impulse? Why did you decide to focus on ADHD?
Yeah, great question. At the time, it was probably late 1980s. I was a junior faculty at Harvard Medical School, and I was working within a group that was doing what we call psychiatric genetics and epidemiology, looking at the distribution of disorders in families and whether we could ascertain genetic components to these families, and if so, what did it mean? At the time, the group was studying mostly drug abuse, schizophrenia, and bipolar disorder. And a colleague, young professor at Harvard, came to us and said, I'm studying ADHD and I'd like to use your methods, but I know nothing about it. Would you like to join me in submitting a grant to the US NIH to try to study this? And I looked at his papers, things that he had written and what his plans were, and I thought, this is pretty good. I like this guy. It's a smart guy. And I liked him personally. I decided, I'll join forces with him. And we did. And it actually turned out to be one of the better decisions of my life, because for a few reasons. One was that we became lifelong friends. Two, he eventually became a leader in the field. This is Dr. Joseph Biederman, who was known as the father of pediatric psychopharmacology in the United States and actually for the world. And also, probably a few years later, it turns out that my son gets diagnosed with ADHD. But that interestingly wasn't the reason I went into it. It sort of happened afterwards. I also went into it because, and this is it's a broader problem with the world, is that childhood disorders in general are, I would say, stigmatized, or a more gentler approach would be to say they're treated as second class. So at the time, and this was late 1980s, early 1990s, adult psychiatry was much more well developed than child psychiatry in the United States. In every way, particularly in terms of research in what we knew. More funds were going to adult psychiatry to do research than child psychiatry. I think that's still the same today in the United States, and I think that's also the case in other countries. It's a real problem because children don't have a voice like adults have a voice, and therefore they don't get the same kind of attention. Now, I say children because remember back then, ADHD we were thinking about it as a childhood condition. We could probably talk more about adult ADHD later on, but that's how I got involved, because I realized this was a problem that really needed to be solved. The other work I was doing, there were lots of other people working in the area, and I felt good about the contributions we were making and that we could make more, but I realized I could even make a bigger contribution if I went into the ADHD world in terms of research and even my clinical practice at the time.
You're talking about children as those who were not, given enough attention. And I just finished interview with Maxim and Sandra about how women also were not given enough attention. What do you, as a male expert, researcher, think about how medical and pharmaceutical research didn't include women?
Well, I'll tell you a story about that. Again, this was in the 1990s. We proposed a study to children with ADHD. What we wanted to do was we wanted to look at them very carefully, like really get a good, careful assessment of them, of their families, and we wanted to follow them up as long as possible into adulthood. And so we sent a proposal to the U.S. National Institute of Health, and it came back, and they liked it mostly, but they said, well, you're planning to study boys and girls, but we know ADHD is a boy disorder. Why would you study it in girls? So we looked at the criticism, we called the NIH, and basically we had to take the girls out of the research project because otherwise they wouldn't give us money to do a study at all.
Okay.
Now, that's obviously awful, right? And as a scientist, you don't want to do that, but you have to, the funding agencies actually control a lot of what you do. But stay tuned, because we didn't give up. We did a study in boys, but we also started a small study of girls as well on the side, because we had money at least that we could work with. And then probably maybe 2-3 years later, we then again submitted another study to say, hey, we've done this in boys, now we'd like to do it in girls. And we have good reasons to think that there's a good reason to do it in girls. And then they finally agreed to that. And so they're actually pretty famous studies. They're called the Boys and Girls Studies of the Massachusetts General Hospital in Boston. And they made some great contributions to understanding the differences, similarities and differences between boys and girls with ADHD.
Do we know why for so many years, so many decades, women and girls were excluded from so many researches?
Well, it starts with what people see in clinics. Okay, research frequently starts with what does the doctor see in front of them. Mm-hmm. Now, in ADHD, boys tend to be very disruptive. They cause problems, right? ADHD girls, we're talking about on average, right? On average, ADHD girls tend to be not disruptive. They're quiet, they're inattentive, very inattentive. They might be sitting quietly in the classroom, looking out the window, not paying attention, getting poor grades, but they're not bothering anybody. Yeah. So when you're a child, you get referred for treatment when you cause a problem for somebody else. But when you're an adult, you refer yourself for treatment. So these girls with ADHD, many of them, it wasn't noticed. And partly it's not so much a criticism of their teachers or their parents, because a lot wasn't known about ADHD back then, but people just didn't notice that there was a problem. And especially, let's take a girl who's a little bit of above average intelligence. Well, so she's getting average grades in school, and people think, well, she's doing fine. Why would anybody worry about this girl? So that's the main reason why there was this. In fact, we started to realize this, and I say we, now I'm talking about the field, not me. I didn't do all the work in ADHD. We did a lot, but not all of it.
Did a lot, yeah. But
as a field, we realized that when you looked in the clinic, I'll give you some rough numbers. The sex ratio in the clinic was about 9-to-1. For every 9 boys, there was 1 girl. So ADHD in the clinic seemed like a male disorder. But when epidemiologists, colleagues of mine, would go out into the community, knock on doors and ask questions, that there was still a higher prevalence of boys, but it was more like 3-to-1. And then we realized, well, something's happening. The girls aren't getting into treatment for some reason, and lots of work had been done. And it basically comes down to what I told you before, that the girls were just less disruptive, less likely to be referred for treatment by their parents.
And so according to the last analysis, the number of girls and boys, men and women with ADHD is the same, or is there any difference?
So, what the current data tell us is that ADHD is still, it's more common in males. Well, this is interesting. In childhood, it's more common in males, but it seems that as people with ADHD get older, their symptoms change. Okay. And we see, and when that happens, we see fewer hyperactive impulsive symptoms. The inattentive symptoms tend to be stronger. Interestingly, most studies show that by young adulthood, the sex ratio tends to even out, and the numbers of males and females tend to become more equivalent. And so studies in the clinic show, my own studies and other people's studies, that you have to have an equal male-female ratio, that the male excess is only in childhood.
Všechno, co zde sdílíme, má za cíl informovat a vzdělávat. Nevydáváme žádné lékařské rady. Pokud máte podezření, že byste mohli mít ADHD, hledejte odbornou pomoc. Náš podcast vás může pouze inspirovat nebo podpořit.
I have a friend who is 70 years old.
Okay.
And as I had the opportunity to be very close to her throughout my life, I've seen her suffering with not being able to fall asleep. She would be always going to sleep at 4 a.m., 5 a.m., no way to fall asleep. Then her home was always a mess, she was not able to organize, having 2 kids. She had to almost like leave them when she was in menopause because she was so depressed. It was really, really hard life.
Yeah.
And now she's in her 70s thinking about if it's worth of trying to do something about it. What do you think?
Well, I think, I always say it's worth, if anybody thinks they have ADHD, they should go see a healthcare professional, find out, first of all, do they have ADHD? Because if they do, as you found for yourself, the treatment can be life-changing. It can be life-changing for a 5-year-old. It can be life-changing for a 70-year-old. Elderly people are treated for ADHD. Although the prevalence of the disorder decreases with age, we do know that by age 60, 70, there's still roughly 1% of the population will have ADHD. Some people, I don't know if you had a chance to see Dr. Goodman's talk here. He's an expert in ADHD in older people. And he would certainly say absolutely get treatment because it can be life-changing for you.
Okay.
It's more complicated in older people because the healthcare clinician has to kind of separate out what is called mild cognitive impairment, which is common in older people, from what's actually ADHD. But that can be done, and it is done by people who have shown that you can effectively treat older people with ADHD.
Yeah. Okay, I'll tell her. Definitely. I'll tell her that one of the most important and experienced experts from the world, told me it's worth of trying.
It's also important that, and you probably understand this from your own experience, that adults who are late diagnosed realize that although we have good medications for ADHD, I like to say that pills don't replace skills.
Yeah.
If you've lived a long life where your ADHD has interfered with obtaining certain life skills, then you need to find a way to get those. And it's not going to be medicine. It might be psychological therapy. It might be something different than that. But it's, yeah.
Okay, you told me she should maybe find a professional. And I would like to talk about this for a while. Finding a professional.
It can be hard, yes.
Because, because you started a wonderful project, ADHD Evidence Project, which is a project about actually combat the misinformation and myths about ADHD. Because my own experience is that when seeking for help for one of my children, we were told by a psychologist that it's all our fault. Me and my husband, we were fighting too much, and that's it. And we should go for counseling, and that will everything.
I'm so sorry to hear that.
Solved by that. We went for counseling. Our marriage, bloomed. The problem is that our child didn't get better. So this is a problem for, and also you're trying to fix it, right?
Yeah. No, it's I call it the blame the parents problem, right? That there's a long history in psychology, psychiatry of blaming the parents. Back in the 1960s, parents were blamed for schizophrenia. They actually had something called the schizoprenogenic mother, the mother that caused schizophrenia. Which was awful. I mean, it's totally awful. I can remember once I used to give lectures to parents of people with different disorders, and this was a mother of a person who had schizophrenia, but the patient was older, and I was lecturing about the genetics of schizophrenia and how it was caused. She broke down in tears because for the last maybe 50 years, she thought she had caused her. I mean, it just, even thinking about it now, it just makes me, it's unbelievable what the profession does to parents. Now, are there some cases where ADHD could be aggravated or a child's misbehavior could be due to difficulties in the family? That can happen. But what a good diagnostician does is they look at behavior in different settings. And if, for example, a child's problem behavior is only happening in the home, the child's fine at school, the child's fine on the playground, everywhere else they're fine, well then you worry something in the home environment is causing a problem. But if it's a pervasive problem in the world, you don't immediately say, oh, it's because the parents are having arguments and so forth. That's just, that's bad. I have to say, I'm a clinical psychologist, but I am disappointed with ways that some of my fellow psychologists deal with ADHD, for sure.
Why is it so? I mean, what do we need to convince mainly the professionals, because there are those who talk to the parents, talk to the patients. Right. What do we need to convince them, and why is it so hard?
I wish I had the answer to that. I mean, part of it is training, because people do what they're trained to do. So my training as a psychologist was very balanced. We were trained in the medical model and the psychological model, and so I knew both, and I was taught that the child deserves medical treatment and psychological treatment. You figure out how to provide them in what combinations. Some psychologists are taught that no, you can do everything with psychological treatment, and you only go to the medical side in rare cases or in special cases, and that's just wrong. And it's actually wrong by all the guidelines we know. If you look at published guidelines on how to treat ADHD, it's in most cases you want to start with a medical approach and then add the psychological approach to that, with maybe some exception being very young children, for example.
Mm-hmm. So according to the research, what's the best approach now, where we are?
We have research in terms of clinical trials that look at what treatments help children and adults with ADHD. And then those have been transformed into clinical guidelines that different groups, like there's the NICE guidelines in Europe, there's the Australians have guidelines, the Canadians have guidelines, and they're all actually pretty much the same because they're all based on the same evidence. And that's what I love about evidence. When you look at, there are very few arguments when you look at evidence. All the arguments occur in places like, Twitter and TikTok when people aren't looking at evidence. Then they argue about this and that, and they say, this is controversial. We know from clinical trials that the medications for ADHD do a very good job in reducing the symptoms of the disorder. There's no question about that. I mean, that's...
Let's say it once again, please. Documented. There is no question about it.
Right. There is no question about that, exactly. There is no question. The medications work very well. They're safe and effective. In fact, some of them have been used for decades. Methylphenidate has been used for over 50 years. I know that many parents worry about, I give my child a medicine that's going to affect their brain. Is that really a good thing to do? And I understand that it's a worry. And look, I'm a parent too. And I had to put my son who has ADHD on medication, and I had a little bit of a worry about it, even though I know the facts. But you have to look at the facts, and the facts are like any medical decision you make. You balance the choices, right? And what I tell parents is that you're worried about these adverse effects of the medication, which are things like, insomnia, not eating, maybe not wanting to eat as much, and things of that sort, versus the adverse effects of not being treated. And the adverse effects of not being treated are actually worse. But it's really awful because there's this whole industry of people who take advantage of fear. And so they tell parents, you can treat your child with my diet, or you can treat your child with my special sparkly toy that you can use, or things of that sort.
That's what I wanted to ask you. Who are these people or communities, or who are these who are like, spreading these prejudices against the medication? Because I don't see it in other fields of medicine. Like, there are maybe, but not so severe, like there are not so many web pages about telling you not to take medications when you have diabetes. Or...
Exactly. Well, I think there's two different groups, right? So there are actual groups which we'll call anti-psychiatry groups. They're just against psychiatric medications. And I have no idea, I've never explored why they're against it, but they're against it. And it's a way to raise money, because if you tell the story that, doctors are giving kids medication and hurting them, people like that. Some people like that, and they say, okay, I'll donate money, I'll join you, because that sounds bad. And of course, it's all lies. It's basically all lies. There are other people who just make money from selling something to people that doesn't work. We call them snake oil salesmen. That's a phrase we use in American English, at least. They're selling something, and because they want to sell hope, they're basically using the parents' hope to sell them something that doesn't work, and they're making money off it, and the child's suffering. I tell parents, I don't treat parents anymore, but when I did, I would say, if you think about it this way, if your child's 5 years old and you think, well, maybe I'll just wait and I'll delay treatment, I'll try these other things, and you delay treatment for 5 years, that means at the age of 10, half their life has been impaired. Half their life they're not making friends as well as they should. Half their life they're failing in school. Do you really want to do that?
There is also this moment when the child or adult doesn't try it. There is no comparison. According to my experience, I couldn't imagine if anybody told me after Ritalin I feel like this and this. For me, it was an experience of completely new feeling I haven't felt before.
Yes.
So I cannot imagine how, what other thing could, help me than try this feeling and try this inner peace, than simply trying it. So maybe when I talk to people who are also like struggling to decide if yes or no, I'm telling them maybe you can also see it as not like the thing for forever, but a bridge to, try it and see, because then you will have the answers.
That's very good, because it's exactly what I do. In fact, I tell you a story. A friend of mine called me up and said, I'm really worried about my grandson. I think he has ADHD. I know that's your expertise, but my daughter takes him to see homeopaths and naturopaths and dietitians, and for 5 years he's, not getting any better, but she keeps trying. Would you talk to her? And I said, yeah, I'll be happy to talk to her, but I'm probably not going to make that much of an impact, because these people, they just want to do that. So I talked to her, and I said exactly that. I said, look, I know you're worried. Why don't you see a doctor, get a prescription? Think about it this way. Your child's going to take the medication for 1 day. If you don't like it, you can stop it after 1 day. Take it for 2 days. If you don't like it after 2 days, you can stop it. It's going to be harmless after 2 days. I'd recommend at least a week or 2 weeks to try it. So she said, well, I'll think about it. I thought she wouldn't do it, but I got a call back in 2 weeks saying, oh my God, I wish I had done this 5 years ago. And you know that feeling, right? That
I know that feeling.
Well, one thing you can, one way to talk to people about it is, many people like you and I wear glasses, right? If a person wears glasses, you can say, just why don't you not wear your glasses for a week?
Exactly.
And then put them back on again. Yeah. And see if that changes your life. Well,
this is the same, yeah.
Would you deny a child wearing glasses?
Yeah. Well, without glasses, I see the impressionist, world around me.
Exactly, right.
It's just, it's fine for a couple of seconds, but then
right,
I like to
try to drive a car.
Sharp, exactly. Yeah. Well, talking about these other methodologies or other non-pharmaceutical ways of treating ADHD. So, are there any? We have research for that they really work and they are not fake.
Sure. Well, so there's a lot of research and non-pharmaceutical.
Další část našeho rozhovoru uslyšíte na platformách Hero a Forendors.
We would discover 1 or 2 genes, get the Nobel Prize, discover a drug, cure ADHD. That was my goal. It didn't work out.
You wait for those who have the money.
It's expensive,
to continue, and sometimes it simply doesn't happen. Neurotypical people tend to advise to us ADHD people,
right.
It's easy. You simply come to the room, you say sleep, and they sleep.
They can play a video game for 3-4 hours in a row and just sit there. How can they be inattentive? Well, they have hyperfocus.
Děkujeme vám, že nás sledujete a podporujete na herohero.co/klid v hlavě podcast a na forendors.cz/klid v hlavě. Díky vám totiž můžeme natáčet rozhovory s odborníky a zabývat se jinakostí mozku z různých úhlů pohledu. Třeba i toho vašeho.